This is the Art Beauty Podcast where we tell the real truth about the fake shit. I'm Amber, and today my fabulous and gorgeous co-host is Miss Courtney Brooks. She is the director of aesthetics for Dr. Dennis Gross, a good friend of the show. She's a licensed aesthetician, a laser specialist, and a chemical peel queen. And for anybody who's ever followed my social, you know I've been sitting in her chair. Courtney, thank you so much for being with us today.
Oh my gosh, this is such an honor. It's so fun for me. It's my favorite thing to talk about, to be honest.
Well, can I just say right now, you are literally glowing.
Oh, thank you.
So what's in the current routine that's going on before we talk about, all the lasers and all of that stuff?
Yeah, I will say I am lucky enough to try everything in our office on myself at all times. I'm actually in Boston this weekend for my brother's graduation. So yesterday, before I left New York, I did a quick peel, an alpha beta peel, just really no downtime. There's not a lot of peeling or anything. I'm not red or flaky or anything. So I did that. I did a little IPL actually, because I have a few like post breakout marks I wanted to hit. And then I sat under the red light for 15 minutes, just so I looked a little like dewy today.
I mean, you look gorgeous. Is it just so much fun for you to be able to have access to all the toys and bells and whistles and lotions and potions you want?
It's my favorite thing to do for everyone else. I mean, when you look good, you feel good. So of course, yeah, I'm like, if I have 15 minutes in the day, I'm like, I'm in the back room, like text me if you need me. And I'm like in the mirror with something all the time.
I'm obsessed with that. And, I have to say the videos that you and Dr. Gross do together are just adorable.
Oh, thank you. It's fun. It's a fun balance because he's so science heavy and I get to be a little bit more silly and talk about like some girlier stuff. Yeah. So it's a good balance with the two of us for sure.
So now I know that he is in the Hamptons. He opened up a practice in the Hamptons this summer. Are you going to be sort of splitting your time between the New York and the Hamptons?
He did. No, you know what? We are so booked in the city. I'm so happy to say the city is coming back. We're buzzing. So I actually don't have an appointment for like 3 or 4 weeks, but we do have an esthetician that's going to be out at the Topping Rose House with him 2 or 3 days a week over the weekend doing facials and peels. So bringing our office out there, and who knows, maybe if we get enough people that want Ulthera, I can like drag our machine out, but
Ulthera is like my go-to jam.
Yeah.
Today I wanted to talk to you because again, we know that you are a laser specialist, you are the chemical peel queen. And one of the things I want to talk about is really focusing first on the lasers, then we'll get to at home. But, we're going into summer now. And I think that, coming out of COVID, we all want to be gorgeous and glowy like yourself. And I do feel like there is such a focus on getting clear, perfect skin, so we want to get rid of the redness. We want to get rid of the discoloration. And I know that 2 very popular treatments are both IPL and V-beam. So let's talk about how we can sort of get our, sort of perfectly clear summer skin. And let's start with IPL. Can you tell people at home who might not know what exactly IPL is?
Yeah, of course. So I think the goal, right, is for all of us, especially in the summer, to not have to wear any makeup, right? We want to put our sunscreen on, get outside, wear hats. So IPL is intense pulse light. That's what IPL stands for. So there's different wavelengths, there's different size of hand pieces. So they all kind of vary. You may see them at your local spa, but then there's more advanced systems, maybe at a dermatologist's office. So our machine is the M22 from this company, Luminous. So they created the first IPL like 25, 27 years ago. So they really perfected the craft. The idea with an IPL is you can get rid of anything discolored that you don't want on your skin. So it's brown, it's red, it's purple, it's leftover acne marks, it's melasma. So they've really fine-tuned, like, I think I have 11 wavelengths on our machine. So you can go after every individual issue that you don't want to see.
I mean, I know I got to sit there and I posted something on social because it was amazing, just the brown spot. And I have one coming up for V-beam. I've been waiting for this podcast before I put out the other social because you also hit some of the red for me. I do know that when it comes to lasers, and especially, I'm glad you mentioned before, sunscreen, we have all these toys to get rid of things. We certainly want to, prevention is the best way to keep our skin bright. But, going into summer and thinking about lasers, IPL specifically, what do we need to know about that, about having IPL and then going out in the sun and being outside more?
Yeah, for sure. So I kind of ask people when they're in the office and they're like, this brown spot's bugging me, or this discoloration is kind of bugging me. My first question is like, do you go in the sun? Right. So I have women that are like on sailboats and they're racing sailboats, or their kids are out at camp and they're taking them in the ocean all day or whatever. Those people, I kind of push them to wait to do IPL until the fall. If
Right.
you're really good about keeping your face covered, which a lot of women are now, which I'm really grateful for, and men, I'm really grateful for. If you're really good about it, we can still treat. You just need to be careful. So the IPL is getting rid of what we see on the surface, but you have cells underneath your skin. You have these melanocytes in your skin that want to pull the sun, and their defense to protect you from the sun is to get darker. So I can get rid of them and make your skin look really clear. But then if you're out laying at the beach, there is a chance they can come back a little bit. So for those people that will be out, I say wait until the fall, and then we can blast it.
Which is a good listen. I'm glad you're being honest about that, because I'm sure a lot of people think, okay, and when we're out in the sun more, really come like July, August is when you start to see, no matter what, and no matter how much sunscreen I wear, you start to see this stuff from sitting as a passenger in the car.
Mhm,
You can see it on the sides where maybe your glasses
mhm.
don't hit, or maybe your hat brim isn't wide enough. But maybe when it comes to this, we kind of want to wait. Talk a little bit about how the process is carried out.
Okay, yeah. So I love using IPL because I have all those multiple wavelengths and I have different tips. So I'm probably doing 4 or 5 different passes or treatments during someone's IPL treatment. So I'm going to go in, I'm going to treat all over because secondary, it does stimulate collagen, which we all want. So we'll do an all over pass. Then I'll put a pass on maybe just for tiny brown. We'll come right under the eyes because actually I find lightening under the eyes, if there's pigment there, makes your dark circles secondary look better. So why not? And then I can put a little tip on to do the broken vessels around your nose. So we kind of go on with all of that. And then what happens afterwards is we're pulling all of that pigment to the surface so it comes off. So it's going to come up on your skin almost like a coffee grind. It'll get a little dry. Within 2 or 3 days, it'll start to flake off. So I usually say 3 to 5 is like 3 to 5 days is your bracket to like look sparkly and gorgeous again.
Yeah, and I'm glad that you're talking about this. So the procedure itself, having done it myself, not super painful. It's not nothing, but they say it's like a rubber band snapping.
Mhm.
Um very tolerable. And then really this is kind of one of those procedures that you don't really consider it downtime per se. You will have those coffee grinds coming, but it's not like if you've done a really excessive peel. It's nothing that can't be covered up with makeup, correct?
Exactly, yeah. I not that anyone's going to galas lately, but I'd say, it's fine to go out to dinner with your friends. You can be out and about. A little tinted moisturizer will cover it. If you have like a really big situation, I
Yeah.
say do it 3 to 5 days before.
Yeah, seriously, you want to wait a week, but I mean, can we be honest here? If you've got a really big event, you never want to do anything the week of.
Yeah.
You just don't. I've learned that lesson the hard way.
Yeah. And also,
um,
I think we can both say too, even when I've done it, like my boyfriend doesn't notice if one of my brown spots is a little dark. Like nobody notices more than we do. So it's easy to hide.
no, but I guess it also depends on how many brown spots, right? So you and myself were lucky, like we don't have a lot, but I guess if you had a lot of serious discoloration that was getting dark at the same time, it might be a little more noticeable. But
Yeah,
again, it's not like some of these procedures where your skin is peeling off, where you're in pain, where you're uncomfortable. Once you leave that chair, it's just kind of like the magic is happening on the surface of your skin and it's not painful.
totally.
Thank God. I recently just had quo and I don't care what they say. It hurts.
I really
It
want to
hurts.
talk to you about that after. That's so interesting to me. Yeah.
It
We'll
hurts. We'll
circle back.
see. If it works, if it works and it's the best thing ever, then I'm going to be super psyched.
Yeah.
But let's focus now back on this in terms of treatments, right?
Mhm.
So what do you normally tell people to come in and do?
So if someone has pretty intense pigmentation, if we're working on melasma, we're actually recently we've been treating this woman who has a lot of discoloration from lupus she's had throughout her life. So that like we're, something like that where you're chipping it away at kind of a deeper discoloration. I would say 2 to 3 is good. I am like OCD in the room where I'm like not leaving anything left on your face. So usually I can tackle everything in two. And then also, people with a little bit of a darker skin type, you have to be more cautious about your settings. So those people, maybe I would say 4 to 5, just because we start super low to make sure there's no damage caused. So on average, 2 to 3, maybe 4 to 5 if you need it.
I'm glad you mentioned skin types and skin tones. Like, who is a good candidate for this? Who maybe is not a good candidate, or who would not be a good
Mhm.
candidate for this?
So with an IPL with so many different filters and depths, honestly, I feel comfortable treating up to a skin type 4 or 5.
Okay.
So someone with a little bit more in their skin, but I am absolutely not recommending someone with that type to walk up the street and get a random IPL. I think it's so important you go to someone experienced, go to a dermatologist office or someone with a reputable past or a lot of experiencing darker skin types, because that's where you can have hypopigmentation. So the lasers are extremely smart, but not all of them can tell brown spot what's your natural skin tone. So it's up to me to make sure I indicate that to the machine properly so that there's no issue. So you can treat someone of a darker skin type, but you need to be really, really careful.
I'm glad you mentioned that too. Some of these things I think, and I try to just reiterate this on the podcast all the time. We've got to be careful when you see a Groupon and it seems like a deal that's too good to be true. It might be, and
It
especially when
might
you're
be.
dealing with things with lasers, in the right hand, they are an incredibly useful tool, but in the wrong hand, they can be really detrimental. I'm glad that you said that. You want to do your
Yeah,
research.
it's really
Um,
important.
and then the post care for this is pretty easy
Yeah,
breezy. You
it's
just don't,
pretty gentle. Yeah, I just tell people your gentle cleanser, your gentle moisturizer, SPF, and makeup. We're skipping retinols, we're slipping glycolics. I'm okay with the vitamin C if it's gentle, but nothing, paired with a glycolic or anything like that. So simple is better.
and no picking at the brown spots because they can feel like a little bit almost like I hate to say the word scab because I think a scab generally is like much more pronounced. These are very little, but you don't want to pick at them or exfoliate.
Exactly. So I let people do a Dr. Rose's at home peel at day 5. So
Okay.
before that, warm water, gentle. You can use a face cloth here and there if you want, but just like when you were little and a scab would be on your knee and it comes off too soon and you kind of have that pink new skin, that's what happens if we pick those brown spots too soon. So we want them to flake on their own to make sure everything looks as beautiful as it possibly can.
I love that. And so now you mentioned before that you actually have tips that you can use for everything. I thought that the V-beam was the one that we used for redness and capillaries. Am I incorrect about that?
No, you're correct. So IPL is kind of like, I love IPL even just for like an intro to laser, right? We want to do everything. We want your skin to look beautiful, but then we turn to some more specific tools when we want to be more specific about what we're targeting. So V-beam, like you said, is strictly for red. It's not touching brown or anything like that.
Before we get to this, because I loved the V-beam, I know that it can depend on everywhere, where you are located in the country, but are there ballpark costs or ranges for IPL?
Yeah, definitely. I mean, I would say, I've been doing some research in our neighborhood. So we're on the Upper East Side of New York. And I've seen it as low as 450. I've seen it as high as 1200. So,
Right.
that's a very big range. That's really, really broad. But I think it also depends on, I'm just trying to get these 2 spots. That's going to be really low. If you're doing full face, neck, and chest, it could be a little bit more. So I think in that range, that's pretty broad. But
Great.
yeah.
And even with one, which I can tell you, you're going to see beautiful difference. But the 2 or 3, I know come fall, I'm coming back.
We do
For
not turn that machine off in the fall. It is just like plugged in. We're just like bringing one in at a time.
I am sure this is a great post summer treatment. Um, Now with the redness. So I
Mhm.
love this because this was one of those machines that wait till you guys see the video for this instant. There's a capillary there and then it's gone. What is V-beam? Let's talk about it.
Okay, so a B-beam is a pulse dye laser. Every laser on the market has a target, whether it's you're looking for the hair, you're looking for a brown spot, you're looking for fat cells, or there's the tiny layer in your skin that Ulthera is getting. The V-beam is looking for anything blood related. So you're talking rosacea, broken capillaries, those cherry angiomas on your body, poikiloderma, like when people get that really red neck. People have those little strawberry birthmarks. You can actually lift those with the V-beam. So imagine anything red or blood trigger driven.
Okay, great. And how is this process done? How does it relate, would you say, to the IPL?
Yeah, I see very little downtime when it comes to the V-beam. So, kind of like what you were saying, if you hit that vessel right with the right setting, it'll pop and it'll go right away. Essentially, the laser is breaking the wall of that vessel down so the blood just re-enters your system. I can even treat a bruise with the V-beam just to push that away from the surface so you don't see it. Yeah, like if you have a bruise post Botox, done. Very cool.
Yep.
But
Again,
then
sorry, I know not to take this off this quo. It looks like somebody drove a truck over the back of my legs. I will show
okay,
you
come
this
over on
afterwards.
Monday. Yeah.
And this would be, you would probably need like, I mean, like what a laser that could shoot down Venus
Oh
for the amount of bruising
no.
that's going on here.
Yeah.
But good to know. So bruise, so if you have like a small bruise, if somebody's going, good. Okay. We've got a way to
Yeah.
kind of get around that. Oh, amazing.
Exactly. So blood related, it'll do that. When you're treating something really red with a lot of body to it, maybe like a bigger vessel or like one of those birthmarks, those people can have a little bit of downtime. So the spot will get a little bit darker. Again, you're still able to put a little makeup on it. This is not going to flake at all. So it could get a little angrier, 2 days tops, but that's for more of like an aggressive treatment, which not most people need.
I love this. And it is, like you said, the results are pretty instant for
Mhm.
most. Okay.
Yep.
And who's a good candidate for something like this?
So someone said to me, any one of the issues, Irish, Welsh, English, those people with a little bit of those pink undertones really benefit from this. Someone who blushes really easy really benefits from this. I have people that can sneeze and break a capillary, or they've broken capillaries at getting facials over the years. So anything red is easy to treat and easy to go away. And you look really beautiful actually from it, I think.
You know what somebody told me? If you are drinking alcohol, can that cause redness that doesn't go away?
Over time, yes. I mean, this is probably gonna sound really bad, but, like, have you ever seen, like, a really, like, old man and his nose is super red, and if you get up close, he has those broken vessels through there? That could be, like, a long life of loving beer. We don't know. So V-beam is easy to treat that, yeah, but even if you have a lot of red wine sometimes, I mean, me personally, I will flush for sure.
Totally, but that flush generally goes away, but that
Right.
type of thing can stay if you continue that behavior.
I don't know. I don't wanna
Okay.
say that. Maybe
That's
yes. I
fair.
think
That's fair. Listen,
over years, yes, maybe.
I'm gonna need to follow up. We'll ask Dr. G about that
Yeah.
because when I heard that, I was like mid tequila and I was like, oh, maybe I should
You're
put
like,
this
"It's
down.
so good, sorry."
Yeah, but you know what? I'll take the face over the booze any
Yeah, yeah,
day.
yeah.
So I mean, let's just, or most
Fair,
days, I should say.
fair.
Um, and with the V-beam, like you said, so is it kind of for most one and done if you've got the capillaries, if you've got just a few red spots?
Exactly. So if we're spot treating, one usually does the trick. When I'm treating someone with more aggressive redness, say they're dealing with rosacea, or I didn't even mention you can treat scarring with it. So when someone's scar or their keloid is a little bit more pink, I can target that with the V-beam to make it more uniform in color with your body. That too is probably your 2 or 3 treatment situation.
Gotcha. What I mean, I
Mhm.
just love what we can do
I
these
know.
days. So, would you say, in terms of going for that clear skin, maybe these are actually procedures though we want to wait until the fall because of the sun?
Yeah, it's safe to say, right? So even if you're having like minor sun exposure, I know for a fact, like it will help, but there's a chance like stuff could come back, right? So if you're going to be out at all, I would say save the money. Let's really go for it in the fall and treat you for sure. If it's little capillaries and stuff, that's not a big deal. But if we're going to really go for like changing your face, I would just say to be safe, we'll wait till the fall.
I'm glad we're bringing it up now, though, because you should probably get your appointments in now if you are listening to this. Because if you think that you're going to be able to call September 1, well, to get into Dr. G's office to see you, you bet you're looking at 2022. But but like really, even for like these popular procedures, because everybody's going to be doing them, you might want to start to book now.
Yeah, definitely. If you're in New York, I mean, I think people are feeling it. Everyone's like taking their nice little beautiful cars out to the Hamptons and it will empty out. And then everyone floods back in the fall before they go to Florida or wherever they're going. So yeah, I would book it now. I mean, there's a lot of fun stuff we can do over the summer if you want to get started on some other things, but these two things I would push if you can.
I love that you just said that. Like, and now how sorry, can we just have a moment of feeling bad for ourselves? Because I'm here. I'm not
Oh
taking
yeah.
my car out to the
Yeah.
Hamptons, and clearly neither are you, right? Or maybe you are. I shouldn't say that, but during the week,
Not really.
we're here.
Yeah. We are
We're
here.
here.
We're in the city. I'm like going to my bodega. Like I might hit the roof if I'm lucky, but like no, I'm not like out on the beach.
The little island, which I
Yeah.
actually have tickets to go, but I feel like it's
Oh
been raining. Yeah, I heard it's
yeah.
pretty cute.
Mhm.
So how about, for this summer then, because you mentioned
Mhm.
it, right? We all want to be out. We want to be doing um things to have that gorgeous skin. What are the things that you would recommend doing now?
So at home, you mean?
At
Like
home or even no in office, and then we'll go to at
oh,
home.
okay. Okay. So in office, I mean, we do a lot of really fun machines that give you a nice glow. We would call it like the Met facial, the Met Gala facials, kind of something like that, where like, I know, where you just look like sparkly and gorgeous. And I will say, like, I think we're all like going to some type of public event for the first time this summer. Like, I'm like, oh my God, I have a wedding. It's the Grammys. But like, I can do stuff where you just look like tight and shiny. And that does not affect the sun at all.
So what is that? What is this magical?
Yeah, so we call it the 3D. So
Oh
it's a
yes.
light, yeah, it's a light peel first, just to do some exfoliation. And then we do something called collagenesis, which again does not see the surface of your skin at all. So it just uses heat, kind of like a laser genesis. I don't know if you've had that before. Using heat to stimulate collagen, give you a little bit of a lift. You just look like shiny and beautiful. And then speaking of the V-beam, there's a photo rejuvenation setting on the V-beam that does not see the color of your skin at all either. And that just kind of tightens up your pores. So we're
Oh,
just like buffering things out. You just look really like tight and shiny and new.
yeah, no. When it comes to you ask me about leisure, I go right to Ulthera because
Yeah.
I'm now at that point. I'm like a little bit of tight. I need like the full Monty
On the
of
full left.
of as much tightening as we can get right now, or at least as much collagen building that we can get.
Yes.
Um, I know at home treatment. So, talking about things like discoloration, talking about things like redness. I know Dr. G has some great at home products.
He does. He has a hefty line for us. I think his number one product of all time, and he'll say this too, his alpha beta peel is
Yep.
such a go-to. It's an easy way to do something at home to get an immediate glow. I have spoke to tons and tons of professional makeup artists that do this before they do their makeup on their clients. Like it just gives you this really fresh face. And weirdly enough, I think it's counter, people don't understand this sometimes, but you can use it even in the morning. So you don't have to be afraid of doing a peel in the morning. So that's going to give you that glow throughout the day. Your makeup lays gorgeously. Just have a sunscreen on.
I'm so glad that you said that too, because I think when people hear peel, sometimes they're like, and some peels can be very harsh, but that is a really friendly one. Speaking of makeup artists, we had Mally on here.
Oh yeah, she's
She
the
is such a
best.
huge fan
Yeah,
of all of Dr. G's products. So,
she's
yes,
awesome.
just shout out to Mally. We love you. And I have to say too, the
Yeah,
body alpha beta peels now are amazing.
they're amazing. It feels so good. Take a shower, shave in the shower, get out, use this towel, and then you put your self tanner on. Forget it. It's like a spray tan.
That's what everybody's been saying. So I loved it just to kind of get rid of like some of the roughness here.
Yeah,
And again, it's pretty
background.
mild.
Yeah.
It's funny when I had Dr. G on here, he was like, just be careful with the shaving. For me, it wasn't a problem at all. I was able
Me
to
neither.
shave. It doesn't sting. It's also great if you're a person who tends to get ingrown hairs
Oh, for
in the
sure.
bikini area. That's a great way to help not have that.
Yeah, it helps the discoloration left over. And to boot, talking about lasers, laser hair removal is amazing for
Oh
that.
yeah. Yes.
Unreal, lifesaver.
I had laser hair removal, like, when I feel like this was 20 years ago. I was young and early in my career, didn't know any better, had a Groupon. Thank God nothing bad happened to it. But now
Mhm.
in retrospect, I mean, I feel like it was in the shadiest, like it was like in a nail salon.
Yeah. They're like, hit the back. Let's do this, lady. Yeah.
It literally, it was not, I mean, God bless, but it's still, I mean, to this day, like I did the full
Yeah.
Monty on the bikini line because I used to get really bad ingrown hairs. And it really is one of those things that, and maybe I guess I could go get touch up. It's not nothing, but that really is like lasts a long time.
Unless you have like a wild hormonal change, it really should never come back.
Oh, amazing.
Yeah.
Well, knock on, well, 50.
No.
We'll see what happens. Wild hormone change. Courtney, thank you so much. Is there anything else like that is your favorite thing to do right now? Because I'm telling you, girl, you are just beautiful and glowing.
Gosh, that's so nice of you. I'm a big fan of face masks at home. Dr. Gross has an LED mask that I am like religious with at home as well. Just over the summer, I mean, I'm like, okay if my skin looks wet all of the time. Like I just want to look dewy. So I'm a big fan of moisturizer. I use all of Dr. Gross's products. I'm a Sephora
What about
queen.
sunscreen? Do you have a favorite sunscreen?
Oh, of course. Yeah. So I actually use Dr. Gross's tinted sunscreen in the darker shade. So his tinted sunscreen, if anyone's ever used like that magic cream from Charlotte Tilbury, it almost has like a little bit of a shimmer to it. So it gives you a nice glow, and it's a physical SPF 50. It's key to use. I'm sure you've said this before on your podcast, like anything physical. So you're talking zinc or titanium for the best block. And his tint has that, and it's not that chalky color either.
Yeah, which is gorgeous.
Yeah.
You also mentioned self tanner.
Mm-hmm.
Is there a self tanner you're loving?
Yeah, I try everything. So Dr. Rose has a glow pad for the face, which I love. I'm a little fairer, so it comes in a wipe. So instead of using the wipe directly on my face, I actually squeeze the solution into my moisturizer to dilute it a little bit. But you might be able to pull off putting it on.
How did I not know this?
Oh my gosh.
He has a self tanner?
Yeah, making it out, sending it. Or when you come for cruising next week, I'll give it to you.
That is so, I had no idea. Okay, so that, okay. All right, well then there we go.
Fab. It's fab. That, and I always go back to Saint-Tropez sometimes also as well. I mean, I use Dr. Gross's for my face and my body, but that one's kind of a no mix up mess either.
Saint-Tropez. I'm new, so like I was a sun worshiper forever. And now obviously know way better. But the self tanner, I have a hard time with the smell of it.
Yeah.
And there's so much white here. I get worried about it wiping off on stuff, but I feel like now the technology, my girlfriends are like, just do it.
Well, Dr. Gross's goes on clear. Actually, that's a perfect one for you. Yeah, it's actually perfect. And the stink is not there.
Thank you, Dr. Gross. I mean, can we just say you have the best job ever. All right, Courtney, if people want to come in, if they want to come and have your magical hands on them, what's the best way for them to book?
Absolutely. So they can book on our website, dennisgrossmd.com, or you can call our office at any time. Our phone number is on the website, or follow us on Instagram at dennisgrossmd.
And can you share your Instagram too?
Oh, yeah. My work Instagram is Ms. Courtney Brooks. I should be better. I should be posting more videos. Maybe we'll get back into it this summer if we have some more time, because it's really fun.
It is fun, and you are so good. And like I said, I have one coming out with the V-beam where you're going to actually see really close up the magic of this going away. So make sure to stay tuned. You can see that on at Art Beauty Podcast and at Amber Milt. You can follow us on Instagram and Facebook at Art Beauty Podcast. Watch us here on YouTube at Art Beauty Podcast. And please sign up for the newsletter. We will be having wonderful specials, discounts, exclusive offers. You don't want to miss this. Courtney, thank you. Happy summer.
Thank you so much.
Congrats to your brother.
Podcast. Thank you. This was so fun. I feel so cool.
It's your first?
Yeah, this was amazing. I'm absolutely sweating, but I feel great.
This is not going to be your last. You're such a natural on this.
Oh my God, it was so fun. It actually was.
I'm so honored that I got to be your first. All right, girl. Yes, I love it. Well, everybody, thank you so much. Thank you, Courtney. And as always, we will see you next Tuesday.
Thanks.